Warning, this video may contain sensitive subject that the viewers may not be able to handle, which will discuss suicide, substance use, and mental health. Viewer discretion advised.
We begin in Australia, where the new year brings no relief from the catastrophe caused by bushfire.
Almost looking like a nuclear bomb as it incinerated the forest, a tiny dose of water turning into a steam.
Have you ever seen conditions as bad as this before? In a dramatic escalation of tensions in the Middle East, a US airstrike has killed Iran's most important military commander. General Qasem Soleimani was the commander of the Quds force of Iran's elite revolution.
We took action last night to stop a war. We caught him in the act and terminated him.
That Iran has launched multiple missiles at Iraq's Al-Assad airbase. This attack is believed to be in retaliation for the U.S. drone strike that killed Iran's top general.
A Ukrainian passenger jet plane has crashed shortly after takeoff from Tehran, killing at least 170 passengers and crew.
The Taal volcano in the Philippines has thrown molten rock into the sky, triggering official warnings that a hazardous eruption of toxic gas may be imminent.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
That retired Los Angeles Lakers basketball star Kobe Bryant has been killed in a helicopter crash.
From flames to flash floods, the orange haze that had taken over the city's skyline, now cloudy grey.
Parts of northeastern Delhi have been left a smouldering wreck. Cars have been torched and businesses burned to the ground.
Global hot zones, the coronavirus spreading.
Fears grow of a global pandemic.
The number of cases of COVID-19 outside China has increased.
A huge spike in cases in Italy. Hundreds of cases in South Korea. New cases reported in Europe.
There are now more than 118,000 cases in 114 countries.
The CDC warned Americans to be prepared here at home, that it's not a matter of if, but when.
They came to demand change, despite a deadly virus, despite the dangers of large crowds, and despite warnings to stay away. Organized under the rallying cry of Black Lives Matter, and in the shadow of the anti-racism leaders that have gone before them.
Around the world, the number of confirmed coronavirus cases stands at 4,444,670.
They can't fight this virus. They're digging thousands upon thousands of graves in the city of Sao Paulo. More than 13,000 to plan.
We are projecting global growth in 2020 to fall to minus 3%. The Great Lockdown, the worst recession since the Great Depression, and far worse than the global financial crisis.
All waking up to the devastating and shocking news that actor Chadwick Boseman has died.
Here in Sweden after that burning of a Quran, and also they were kicking around the Quran in Malmo. That obviously caused major riots.
The world surpassing 1 million deaths from the coronavirus.
In the last few minutes, President Trump tested positive for COVID-19.
There is hope that by the end of this year, we may have a vaccine.
Program manager Mark Person with the Pima County Health Department says this new spike in suicides was first reported at the start of the pandemic. In this graphic from the health department, you could see the increase in week-to-week numbers from February to March. The sharpest increase was 15 suicides within 14 days. Person says it's normal for a crisis situation to have an effect on people's mental and emotional health, especially those who are already struggling. 79% of the suicides reported in this spike occurred in people with mental or physical illnesses.
I guess I could be pretty pissed off about what happened to me, but it's hard to stay mad when there's so much beauty in the world. Sometimes I feel like I'm seeing it all at once, and it's too much. My heart fills up like a balloon that's about to burst. And then I remember to relax and stop trying to hold on to it. And then it flows through me like rain. And I can't feel anything but gratitude for every single moment of my stupid little life. You have no idea what I'm talking about, I'm sure. But don't worry. You will someday.
I come here to raise awareness. I'm hoping it's going to touch a lot of people's lives to affect positively and to let others know how it has affected me. I do have a lot of people that don't like me, and I'm okay with that. But what I am not okay with is false rumors and out of context situation scenario that people don't know about personally. There's going to be a lot of people that see me, that recognize me, that may not like me for personal reasons or for other things for that matter. Honestly, I don't care. And I'm simply doing this to try to help others because this is way bigger than me. I have lost so many close people and families due to mental illness. So many people that I've cared about. And so many people around me have suffered mental illness. I just want to not only carry on their legacy, but to help raise awareness. And my intention is to save lives and to let others know they don't feel alone. Mental illness is going to be a very sensitive subject. This video is going to talk about anxiety, depression, and any kind of disorders that might be triggering to others. And I just wanted to let you know that you are not alone. Whenever you lose somebody that you really care about due to mental illness and other things that have been going on, and there's been a lot of things that has happened in the past year. Coronavirus and everybody feeling isolated, and anxiety and depression has increased. People using substance to help cope with things. This video is going to cover everything, and I'm going to do the best of my ability to explain everything about it. Honestly, I hope everybody the best, and I just want everyone to succeed and to do their very best. You only get one life, and once you realize that somebody that you really care about is gone and no longer here, that's a different kind of pain. And you kind of just mature and grow up a little bit and just move on from things to better yourself and to try to bring a purpose in life to keep yourself alive and well. The reason why I'm at the beach, I feel more content and makes me feel at peace, helps with my anxiety. I'm able to focus to try to pursue to make this video possible. I interviewed Lydia, who's a psychiatrist, and I asked her questions specifically about medicine so that way nothing gets misled. I also interviewed Derek, who's a therapist, and I asked him questions about mental illness and trauma. I am so thankful for them that they were able to agree for me to interview them for this education and mental illness awareness purposes. So this is what they said.
So my name is Derek Bowers. I'm a licensed clinical social worker here in Johnson City. I work at the Next Step Behavioral Health and kind of see clients there for therapy. My background is I have a bachelor's in psychology and a master's of science and social work from the University of Tennessee in Knoxville.
Hey, I'm Lydia Powers. I'm a psychiatric mental health nurse practitioner, a PMH&P. I work with patients and talk with them and come up with a diagnosis, and I treat them with medications. I've been doing this for several years. I started off as a psychiatric nurse, and I worked in the hospital in an inpatient setting. Now I do mostly outpatient. I work with adults and kids with mental health issues, depression, anxiety, bipolar, schizophrenia, drug abuse issues.
First question, what is a bipolar disorder?
So with bipolar disorder, I actually have my DSM with me because I'd like to reference that, but bipolar disorder has two major issues that we run into in the field. One of them being that there's a lot of misinformation, so people have a lot of misunderstandings about what it actually is. But also, too, because of that, it gets overdiagnosed, and so we run into countless clients who have bipolar disorder, or they say they do, and once we get into it, we actually can attribute it to other things. So really quick, just to break it down as best that I can, bipolar disorder is actually broken down into two separate disorders, bipolar 1 and bipolar 2 disorder. And I'm going to do my best to make this as concise as I can. But basically, bipolar 1 disorder is mainly known for a person experiencing what's called mania. So mania, in a manic episode, is when a person for 7 straight days, experiencing some of these symptoms for most of the day, all 7 in a row, meets criteria for a manic episode. So the 7 that are listed, but they only need 3 of these in order to be manic or considered to be in a manic episode, would be like inflated self-esteem or grandiosity, which is kind of like imagining themselves as a version of themselves, like gonna suddenly like save the world, or I'm gonna go start my new business I've never thought of before immediately. A decreased need for sleep, kind of like insomnia, but they actually don't feel like they need the sleep, which makes it different than insomnia. They're more talkative than usual or have rapid speech. They have flight of ideas, or feel like they're experiencing racing thoughts. They're easily distracted or distractible, or they have very almost obsessive goal-directed activities, so they're very honed in on something almost to a fault. And then as well as excessive involvement or activities that could be risky for them. So that could be like very risky, dangerous to their physical self, as well as maybe some like sexually risky situations that could actually get them in harm's way of some kind. And there's many more examples, but that's the gist of the first one. The differential for bipolar 2, though, is a little bit different. So if you meet criteria for mania, that's 1. If you don't, but you meet criteria for what's called a hypomanic episode or depressive episode, that is bipolar 2. But to make that short, hypomania is basically a lesser version of mania. So instead of 7 days, you have 3 of those same 7 for 4 days, and they're typically a little less intense. And whereas it also, to have bipolar 2, you must also experience 1 depressive episode, which we may get to talk more about later when we talk about depression. So that's where I'll talk about what that is. Okay. So some big things, though, on top of those symptoms that are really important is the fact that a lot of those symptoms do parallel with so many other mental health disorders, which is another reason why it can be misunderstood or misdiagnosed. And so the other criteria necessary for that disorder is that it is not related to substance use, addiction, another mental health disorder, neurological issues. Basically, we have to make sure it's not other things before we decide that it's bipolar. So a person could actually read that list and feel that like, oh, I really identify with that, but maybe there's other things that make that very complicated. So that's why it's so important to see a mental health provider if you can.
First question, what would happen if you stopped taking your medication without your doctor's guidance?
So yeah, whenever you're prescribed any psychiatric medication, it's really important to talk with your doctor if you're wanting to stop it and not just abruptly stopping. It can be dangerous depending on what medication it is. it can definitely send you into a psychiatric emergency or even a medical emergency. So very, very important not to abruptly stop your medicine. If you do want to stop your medicine, you can talk with your doctor and come up with a plan to like taper down, or they can tell you if it's safe to stop without a taper. But it's definitely not a good idea to just stop abruptly.
Second question. What is anxiety and what can cause it?
Okay. Well, anxiety, so I won't go into like every, anxiety disorder, but just kind of some general themes that I talk with clients about in different disorders. So I work with clients who some of their anxiety involves like excessive worry. So they what if and worry to the point it affects sleep and their ability to stay focused in their life. I work with clients who experience social anxiety, who is like, they enter a social setting and they're overly aware of their situation, or they're hypercritical of how others perceive them or themselves. There's clients that have separation anxiety, that feel very anxious being away from people they love. And there's even panic attacks where people have massive muscle tension, difficulty breathing, and they almost have to shut down for a bit until they can feel calm again, and it's overwhelming. So there's so many different forms of anxiety that we spend time breaking apart and trying to section as best we can so we can focus on it. But potential causes for anxiety, it's therapy and mental health works a lot with kind of correlation, but there are some things that kind of do make it more likely for a person to have anxiety, or really any other emotion we're talking about. But trauma is definitely a huge one. Whether it's childhood trauma, adolescent trauma, trauma in adulthood, or all the above, which happens for some people that I've met, can affect your environment, how chaotic or structured your environment is growing up, or even how you're treated by your parents and or your loved ones. So basically the people you've attached to and how healthy or maybe unhealthy that relationship is. In addition to just human experience and hardship, like, families divorcing or, losing someone, like grief, things like that. So any of that can stem into anxiety or even other mental health issues or emotions.
Second question. How can not taking your medicines impact in suicidal thoughts?
Not taking your medicine can definitely worsen suicidal thoughts. Depending on what medication you're taking, if you stop your medicine, some of your symptoms can come back, such as suicidal thoughts or even hallucinations, which the hallucinations could be telling you to do things to hurt yourself or hurt others. They could be really dangerous. Other medications as well, if you stop abruptly, your depression can come back, and then it's much harder to stabilize. A lot of the antidepressants you have to take for 4 to 6 weeks. So if you stop them, sometimes it takes a while for them to work again. So just because you start taking it again one day, it's not going to be effective yet. You're going to have to build back up.
A third question. What is depression? What can cause it? And what can we do to prevent it?
Sure. So I mentioned this briefly when I was talking about bipolar disorder, where there is a depressive episode, and that's so I want to explain what a depressive episode is, but also explain why depression is separate from bipolar, or the ways we separate those as different forms of disorder. So basically, though, a depressive episode is a 2-week period of symptoms where you experience those symptoms each day for the 2 weeks, most of the day, and it does have to be at least depressed mood or loss of interest or your pleasurable activities does have to be present for this to make a depressive episode. But out of the nine different options or 9 different symptoms, you have to at least have 5 in order to meet criteria for a depressive episode. And this does carry across different depressive episodes and is applicable to a point of bipolar. But so depressed mood most of the day is the first one. A diminished interest in typically pleasurable activities. That can be significant weight loss or weight gain. It's a certain amount of BMI that occurs. Insomnia or hypersomnia, so that's not getting enough sleep, oversleeping too much. So this can be psychomotor agitation, which is more of slowed down movement or body fatigue. Can be fatigue in general, so loss of energy overall. Feelings of worthlessness or excessive inappropriate guilt to the self. Inability or difficulty to concentrate, or recurrent thoughts of death or suicidal thoughts. And so a person would have to have 5 of those to meet criteria for a depressive disorder, which then makes us look more towards like maybe major depressive disorder. But just to go back a little bit, what does make bipolar 2 different from a depressive disorder is that to have bipolar 2, you have hypomania and you have a depressive episode, whereas if you did not have the mania or hypomania and you just have a depressive episode, we're looking at depression. But as far as kind of what causes depression, some of my answers are kind of the same. There's kind of that, it really depends on the person, so it kind of goes back to trauma or how people treat you or mold your perception of yourself, whether that's through your peers or your parents. So it really comes down to your life experiences as well, whether depression may be present, but it can also include, some people do have some genetic predispositions for those diagnoses or disorders. And some of these disorders can actually emerge in later life or young adulthood. So that can also be somewhat of a cause or occurrence.
Third question. Once you're diagnosed with bipolar disorder, how often do we have to monitor their condition and their medication?
Yeah, so typically patients with bipolar disorder, if it's pretty stable and if we have a good medication regimen, I typically like to check in every 3 months. If it's not stable yet and if it's newly diagnosed or if we're adjusting medicine, I would want to check in much quicker, more often, sometimes every 2 weeks or even every month until we get a good regimen and feel good about it. And if they're stable, then I push it out to about every 3 months just to check in.
Fourth question. How can we as a society, family, friends, help with someone with mental health issues?
Okay. Well, I like the way you broke that down, so I'm kind of breaking it into categories. The first one you asked, societally, how can we help? There's a lot of answers here, but to try and make it applicable, I'll maybe say 2. So the first one I think that would be really helpful for impacting society-wise would be just more education. So I really wish that there was like some way to even bring it into school systems early on, because really a lot of my conversations with clients happen about how their childhood and their adolescence molded them and formed all of these maladaptive behaviors and patterns of life. And so really the earlier we could put in education, just to have another voice in there outside of their experiences, that would be phenomenal. Of course, getting all that situated is very complex, so I won't go there. But the second one though is more of like maybe our perception into society. So a lot of times we have things happen to us by strangers, we see chaos in the world, and what I end up kind of talking with clients about is how all of that behavior does serve a function. Now, it doesn't excuse it, it doesn't make it okay by any means, that's not what I'm saying, but if we understand, okay, this person is being very negative, or maybe they're trolling a video online, maybe they've got some self-esteem issues, and that's their way of getting out and overcompensating. So it's not okay, but it helps us understand why it's happening, and that helps us process what we see. So as a society, that's a couple things maybe. Now, as far as family and friends, I'll group those together. The biggest thing is just, be observant of your loved ones, of your friends. So we tend to know our friends' patterns. We tend to know what they're like on a good day and a bad day. But we also sometimes can tell when there's a change in that pattern. So, maybe somebody who's talkative suddenly gets quiet. Maybe someone we know who's hanging out all the time is suddenly not attending things. Or maybe, suddenly they just seem very different in their perspective. The way they speak is very different. Check on them. I don't know how many times I've heard someone say, like, I didn't pick up my phone for a week and no one just asked me how I was. That has been monumental for many of my clients. And so when in doubt, ask them. Don't over ask them, because then they may shut you out too. But when you notice something different, just check on them. And that typically covers a lot of ground and makes them feel less alone.
Fourth question. What are the negative effects of consuming alcohol with medication?
Many medications aren't meant to be used with any alcohol at all. It can be very dangerous. It can even increase the blood levels of the medicine, which could be dangerous to your organs, and then also it could make the medicine not work as well. It can also decrease the levels of the medicine, so therefore it may not be helping with things like your mania or suicidality or things like that. So, and that can actually occur not just with alcohol, but even with like nicotine or other substances as well. So it's very important to be honest with your doctor if you do use substances, so that they can be aware of that when they prescribe.
Fifth question. Can living with someone with mental health issues affect your mental health?
Okay. it's kind of a yes and no answer. So I work with a lot of my clients. Sometimes while they're dealing with their mental illnesses or their disorders, they're really worried that they're kind of being a burden or a bother. So I don't want to misspeak and create that message. But my philosophy, or the way I kind of think and teach clients, is like our brain is always affected by what's around us. So, you know, if you're in a pleasant environment, you're going to probably feel a little more pleasant. If you're in you know, you're somewhere busy and loud and it's chaotic, you're going to feel a little less comfortable in that moment. So the same applies to our loved ones' mental health. So, you know, you have a loved one who's having trouble with anxiety, or maybe it is depression, or a whole host of other diagnoses. You know, maybe they're not getting to do their chores as much as they like, and so maybe other family members do have to pick up and do need to help in that way until they get back to a place that's healthier for them. So of course they are impacted by that, but the person with mental health is not like at fault. They're not at fault for that. That's just how things are right now, and that can eventually change in the future. So the answer is yes. You know, there is going to be an impact, but you know, again, it's not necessarily anyone's fault. It's just kind of that's kind of how the pieces fall as that person is trying to heal.
Fifth question: what advice do you give to patients that suffer side effects of medication?
Anytime you suffer side effects, I definitely recommend talking to your doctor about it. A lot of medications have, you know, other alternatives that would be similar that may not have those side effects. It is important to keep in mind that all medications can have side effects. You know, it's possible with any medication, but if it's, you know, affecting your quality of life, and rather than just stopping medicine and saying, I don't want to deal with the side effects, you could work with your doctor and come up with a different med that might work better for you and not have those side effects.
Sixth question: what are the big red flags that we should watch out for people with suicidal thoughts?
Yeah, so I'll try to cover as many as I can think of, and there's probably some that I'm going to miss, but definitely some that I mentioned earlier that apply here too are like, if you notice people are having changes in behavior, so especially the changes that involve like isolation. So if someone they're not responding, they're not coming out anymore, they seem like they're just kind of closing off more and more. Some people need me time, but typically if it's a lot, that's a sign of isolation. Some of them can be hinted at, so that maybe because in small ways sometimes people communicate that they want help. But no one really teaches us how to communicate that help, and so sometimes actually they may make flippant statements or jokes about like, oh, I just wish I would wake up, or oh, like, I wish it would just all stop, you know, and sometimes people say that in jest, which is its own problem, but that's a time when typically, like if a client says that, I just very calmly ask, like, are you having thoughts of suicide right now? That statement sounded pretty heavy. And the rule of thumb with that is to ask directly. Don't skirt around it. You know, don't say like, hey, are you thinking of like doing something? Because like they may just go, nah, it's okay, nah, because it's vague. Versus like, hey, I'm worried about you. Are you having thoughts of suicide? But also, again, don't berate them every time they may make a joke, because then they may not. They may close off too. So again, it's that balance. But some other ones that can be surprising is if somebody just suddenly starts getting rid of all their stuff. Sometimes it can mean that they have identified a plan. And maybe are ready to act on it, and so they're trying to get rid of their belongings, essentially. But another one that can be surprising is that if someone who's kind of seemed depressed and just seemed really down over and over and over again, one day comes in super happy and well, which if they're having a happy day, awesome, but sometimes we call that like a very bright affect, which means that maybe they've decided to go ahead and act, and they, as odd as this sounds, feel free that they're going to no longer be in the pain they're in because they're about to complete their plan of suicide. So there's more that are not coming to my mind now, but those are some that are sometimes very surprising. That can be a sign that like, hey, my loved one is having thoughts of suicide, or maybe ask them directly.
Sixth question: do you believe there is a correlation to alcohol consumption with suicide?
Yes, definitely. When you drink alcohol, it definitely impairs your decision-making abilities, so it can make you much more impulsive. It's definitely related to a lot of suicides. I don't have the statistics right in front of me, but certainly it is.
Seventh question: can someone with no history of mental illness or depression suddenly become suicidal?
Gotcha. So this one's kind of also maybe a yes and a no. one maybe answer of yes could be that like there are some mental health disorders that do pop up in later life, or can pop up in later life. Like I know some forms of schizophrenia, as well as I know there's a range where also bipolar disorder can pop up, and that is the case for many disorders. They can actually show up in like adolescence or teenage years or even young adulthood, leading up into the 20s. So one of the answers could be yes, because that has emerged, which then kind of as a byproduct starts to generate maybe thoughts of suicide or a change in their perceptions. But also too, I mean, someone could also suddenly have a major trauma or a major event, and that could quickly lead to kind of a snowball effect, which could land them at experiencing suicidal thoughts. But typically there's going to be a source which causes them to emerge, instead of them just suddenly emerging. So kind of that yes and no answer, which is common for the field.
Except question, does the fear effects of taking medication affect their ability to improve their mental health?
Yes, absolutely. I've worked with many patients who are afraid to take any medications at all. It does make things really challenging. Ultimately, it's the patient's decision with whatever they're comfortable with, but I try to educate them as much as possible. Just we weigh the risks versus the benefits of it, and if it makes sense to them and if they feel comfortable with it, then we proceed on. I don't ever like to make patients take medication if they're not comfortable with it. Also, some patients are more comfortable beginning just with therapy rather than starting medications, especially if it's a new diagnosis or if they're new to treatment in general. I recommend therapy for pretty much everybody. With therapy, there are no potential side effects. A lot of people are less scared about that. So people who are afraid to take medication could definitely go with that route and begin just with therapy.
8th question. When you're in a relationship, being in a physical, sexual, and emotional abuse, can that cause trauma during or after the relationship, after it ends?
Yeah, so, and actually the answer is both. So, trauma can begin to have impacts immediately, and typically it tends to. Whether there's sudden emergence of new emotions, or it starts normalizing to them what is and is not okay in relationships. It also kind of can create very erratic patterns of behavior where, they're, one minute they're doing well, the next minute things are going to complete chaos. Or it kind of creates a cycle where they feel attached to this very chaotic person and they don't know how to get out. So definitely during, the effects begin and kind of grow immediately, but also afterward there can kind of be after effects. So there is the possibility that people experience delayed expression of their trauma, and so they can get through an experience and then months later they can be hit suddenly with waves of the experiences that they've had. But also too, then people begin to learn once they're separated and going through the contrast of being out of that trauma, what their triggers are, things that surprise them that they never thought would cause them to have, anxiety or a panic attack. So there's kind of layers to trauma. There's both what happens during and then the healing process, which is very difficult because trauma does kind of get, for lack of better words, it almost gets the brain stuck. It doesn't know what to do with the information, and so then they're kind of set in this limbo and trying to figure that out. Or maybe they do learn to heal, depending on what things buffered them or hindered their ability to cope. So kind of yes to both of those.
A question. If people are afraid to take medication, what other alternatives are there to help with their mental health?
Yeah, so there are definitely other options other than just medications. There is therapy. Sometimes when I mention that to patients, they say, I've tried therapy and it doesn't work for me. But I do encourage them to continue to try maybe with a different therapist, a different type of therapy. These days there are so many different kinds of therapy. Some people find like the group setting really helpful. Some people just like talk therapy. And then especially for trauma, there's like EMDR therapy, eye movement, desensitization, and resensitization. There are all sorts of different therapies that could be really helpful.
Next question. When being manipulated or bullied online or falsely accused by people, can that create trauma or suicidal thoughts?
So definitely. One thing I talk with clients about a lot is I can look up and I can see that the sky is blue, but if I have someone tell me 100, 200 times that the sky's purple, I'm probably going to start looking up and questioning things. I mean, that's just how our brain works. So online, social media, especially where there's a lot of anonymity and people feel a little more inclined to say things in the raw or hurtful things because they can get away with less consequences. Absolutely. So, the brain learns by repetitive entrance of information. And so, let's say a kid or a teen or even an adult, I mean, really all humans, if they encounter 10 plus, 30 plus, 100 plus people sending these messages to them, and then let's say you add on, maybe there's a parent saying the same thing, or a spouse saying the same thing, or close friends saying the same thing, suddenly they have their thoughts about themselves against hundreds of messages, and the brain's going to start to absorb that. We internalize that as human beings, and so absolutely it can result in thoughts of having worthlessness, which can lead to suicide. That can be, categorized as emotional, psychological, or even verbal abuse, depending on the statement said. So really depending on the person and how much they experience that, have an absolute yes to that question, unfortunately.
Ninth question. How can substance use affect your mental health?
Definitely can affect your mental health in a lot of ways. Lots of people I've noticed use substances to cope with their mental health issues, such as depression or anxiety. Alcohol is very commonly used in addition to marijuana. I've found that it doesn't always help long term, and sometimes it is helpful for people short term to numb the pain, but ultimately that's all it's really doing. And even though alcohol is legal and marijuana is legal, like I've seen lots of patients who use marijuana and it worsens their anxiety or makes them paranoid. So even among the legal substances, they definitely have their dangers as well, in addition to the illicit substances, like cocaine and methamphetamines and things like that, which I've worked with lots of patients who do use those kind of substances to try to deal with their mental health issues.
10th question. Do you think people with past traumatic experience can increase their risk of being alcoholic?
Absolutely. So I work with a lot of different clients who either are experiencing alcoholism or really any form of substance abuse related to addiction, so that can involve any substance. Limited within therapy, because if they need higher level of care, I send them to IOPs and things like that for their safety. But most of the time when we get into why someone is using, why someone is drinking, or whatever their substance of choice is, there's always a function. Oftentimes it's self-medicating, or it's a form of trying to numb out the pain at which they've experienced. And majority of the time, I won't say all the time, somewhere in there we find trauma. I mean, almost every time. And we really do a lot of what's called dealing with co-occurring disorders. So it's the idea that you can have a substance use disorder as well as a mental health disorder, and they happen at the same time, and in many ways relate to one another and how they function. So absolutely yes, trauma can quite often lead to that, especially if they don't know how to cope. So they try to numb because they only know how to escape from the pain, unfortunately.
11th question. What is the difference between everyday anxiety versus clinical anxiety?
Yeah, so good question. So, and this actually brings up a really important point with our DSM-5 or the DSM period, is that almost under every single diagnosis in there, one of the clauses at which have to apply is that it causes clinical distress or dysfunction in their life. And so to kind of break that question apart, so like everyday anxiety would be like, oh, I have a presentation or I have a test later and I want to do good on that, because our emotions are not inherently good or bad. They're actually designed to help us function in our life. So like anxiety, for instance, typically it helps us, stay on top of things we care about. We're nervous about them because we want to do well on them, or it affects our life in some way. So it keeps us on our toes and it keeps us attentive. And so that could be more normative, like I said, presentations, job interview because you want to get the job. But whereas like clinical levels of anxiety could be like, I can't sleep at night because my mind won't stop. I actually do completely worse on the thing that I'm trying to accomplish because I'm so anxious and fatigued from my anxiety. So really it's about how much impact does that emotion have on your life and how much dysfunction does it cause in your relationships, your job, or any other environment you basically function in.
What is a diagnosis that often goes underdiagnosed?
Okay. Two come to mind, but there may be more, of course. I haven't done the recent stats, but I know trauma right now is something that is starting to kind of grow in understanding and education, but it is still something that I find with clients is underdiagnosed. I mean, I definitely never want to throw a PTSD diagnosis onto someone, but I don't know how many times we've been assessing symptoms and going through information, and sitting at the core of that is trauma, and unresolved trauma at that, or complex trauma where there's just trauma after trauma after trauma. And so so trauma is often underdiagnosed, or sometimes it's misdiagnosed as other things, when if they really dove into those other symptoms, they would lead them straight to the trauma as when it began. Another one sometimes too is anxiety. Anxiety kind of gets misunderstood and misdiagnosed because anxiety produces so much energy. There's so many parallels between anxiety, but really a lot of different diagnoses where, like ADHD and anxiety both share a lot of high energy, high distraction, difficulty concentrating, but for different reasons. PTSD can have overlaps with anxiety, with depression, and even some other disorders like, where there's psychosis and other things that could be induced by the trauma. And so the amount of overlap results in misdiagnosis, which kind of also then results in, of course, the underdiagnosis of those because they are not assessed correctly. So trauma is often underdiagnosed. I think anxiety sometimes gets grouped into that by being misunderstood, and really just how many things overlap, which is again why it's important to see a mental health provider who can kind of help kind of make separate piles of each of those different symptoms.
13th question. Can social media affect your mental health?
I mean, absolutely. Especially in a day and age where there's so much access, and at least as I'm seeing as many of us get older, like the access is happening sooner. I mean, basically, again, kind of thinking of the brain as like something that takes in information. Whereas, in a day-to-day interaction, if you're hanging out with a group of friends, you're only going to take in so much information. But then on social media, you can see hundreds of messages, hundreds of comments, opinions, and inputs, and have not really any clear idea of how valid or as far as like the research behind them, or even just like where that person's thought was at if they gave an opinion. And so quickly you see a person getting influenced by hundreds of messages with senders they don't quite know where they're coming from. But also too, something that can happen is it creates sometimes a relationship with the brain. And so like, for instance, based on how many likes somebody gets, that kind of releases some dopamine, which is some of our pleasurable neurotransmitters. So then they start seeking, again, that approval online. But if, certain things are kind of the status quo, what does that approval mean? What does that mean they get into? And so it can have its great moments because it can make people feel less alone, and it can cause laughter, and it can cause a sense of unity. But then there's the destructive side, as all things we need balance for and moderation for, where it's almost consuming, or it can be really deprecating depending on what they're getting into. So it really depends on the balance, but there's pros and cons to it for sure.
In this part, I had people that volunteered, and of course, with their consent, that they wanted to share their testimony of their experiences with mental illness. And for not only that, I appreciate them so much for making this video possible. The first question that I ask is, how do you feel about mental illness?
It can drag you down as far as you want to drag it down. Significant others can drag you down, fighting, arguing, but as humans, we always run to drugs or alcohol or just anything of that nature to get rid of it, but that's always temporary. So I feel like you have to find yourself in order for you to be okay, and it takes months, years, or however long you need to find yourself, and always come to friends that you can really trust and talk to and that understand you. You want people that understand you and know who you are. If we work together in this lifetime, we should be doing good.
Mental illness does not fit in a box. Like, it can be one thing one moment, it could be another thing another moment for that same person dealing with that. People will take it seriously when it's happening, but then in the back of their mind or at the back of the times, they're not taking it seriously, whether that be anxiety, whether that be stress, whether that be depression, whether that be anything. But how I feel about mental illness, in the form of depression really is, it's a roller coaster. To be perfectly honest with you guys, I have struggled with some serious dark stuff throughout my life. My first suicide attempt, I was 10 years old. And all that stuff still haunts me because people look at me and they see, you know, this happy person. I travel a lot. I'm chasing all these different accomplishments. But people don't realize that you can literally be as absolute happy one moment and literally just completely destroyed emotionally the next minute. And that's how it works with clinical depression. I mean, I still struggle with everything of depression, no matter of, you know, all the places I've traveled within the last year, you know, not all the business accomplishments. Mental illness does not fit in a box, and it does not just have a one-fit-all answer.
It's something that is not really talked about or taken seriously as much as it should.
I feel like people don't realize it, and sometimes they push it away and don't realize that they may even have a problem, or maybe they do realize it and they just don't want to accept it.
It's a struggle, but it's also very important. And I know the older generation, talking about mental illness is like taboo, and it still kind of is today, sadly, but it needs to be shared. Everybody needs to share their stories and get through this together.
Mental illness is real. I feel that it's very overlooked and that it's not talked about enough. I think that people may have a mental illness, whether it may just be depression or anxiety, and they're embarrassed or they don't realize what they're feeling. I feel that more awareness needs to be made and to take the stigma out of it. And that, you know, depression and anxiety, people say, well, that's not a mental illness. Well, it is a mentality, and it is an illness, and it's real. And I feel that, you know, by stepping up and saying, hey, you know, I've had depression or anxiety, or, you know, I've gone through this and that makes it more real for other people, so that they will be able to talk about it. And they'll see real people, real teachers, real doctors, real, you know, teenagers, or whomever it is that, you know, you interview, that is real and it's okay. And maybe they will seek help for it, because it's important to take care of your mental self as much as it is your physical self.
I believe it's real. I believe there's a lot of people that suffer from it. And it comes in so many different forms, with anxiety, depression. I mean, there's just, it's a big question. But having suffered through some things myself, I'm sure of it. It makes me sad for people. It's when we talked earlier about the guy that I went to the gym with, when he asked me, you know, when I asked him, how are you doing? And all of a sudden, in just a minute, he's crying, right? And I'm like, I got to get away from this guy. What's wrong with him? Later in life, when I go through my own demons and have to fight my own battles, and I see him again and ask him how he's doing, and he's emotionally upset, now I'm drawing closer to him, and I want to know, hey, what is wrong? How can I help? Because I've been there. It's hell, and I want to help anybody that's in it. You know, so if you're dealing with if you've never dealt with mental illness, you'll run from it when you see it. But if you've experienced it, I hope that you're the type person, after experiencing it, that you reach out to others to do anything you can to help them.
Mental illness is something that needs more attention. It can cause a lot of havoc on your own personal life and your own well-being, and it can also change the way that you think about things and how you interact and treat people. It's very important that we realize our own faults and what we can improve upon in ourselves, and overall become better people. And it's something that's very dangerous if it's not treated properly.
It's a problem. There's a lot of people that have it, and a lot of people don't want to talk about it, and then there's the people that are pretending that they have issues, but the people who really do always get ignored. It's something that really needs to be dealt with. There's a lot of people that are suffering from it right now.
So I feel like mental illness for me personally has definitely been affected from coronavirus, because I'm so used to just being out and hanging out with my friends and everything, and once the COVID-19 hit, I was just isolated and where everyone had to stay in. It really affected my mental health.
I feel like society has put a kind of a taboo on mental illness, that if you don't talk about it, it's not really a thing, and I feel like that is not what needs to be happening in today's day and age, especially with losing so many young people and loved ones and people that we care about and cherish in this world. And sometimes it's okay not to be okay, and to talk about it, and to want to talk about it, to feel like it's okay to talk about it, to openly talk about it. Don't feel embarrassed, ashamed, because we all are going through things that is hard to talk about, but mental illness is something that needs to be accepted more in today's day and age, especially with losing people that we love so much.
I feel like mental illness should be treated just as any physical illness. It's very serious, and I feel like it's something that we all need to bring awareness to, because, like I said, it's just as serious and it's taking just as many lives as any physical illness.
I think it's something that we've made a lot of progress in recently in the past 20 or 30 years, especially in the 70s, but there's a lot of research that still needs to be done. There's a lot of illnesses that are underdiagnosed. There are people that aren't able to receive the proper services to assist them when they're coming to dealing with trauma or dealing with any kind of psychological issues. And so there needs to be a nationwide investment undertaken to try to assist these people as much as possible, because ultimately the future of our country depends on that.
Mental illness to me, I feel, is misdiagnosed in a lot of ways. It's like a lot of people I feel have mental illness but will not admit it or are not aware that's what they have. Like, I don't think they're aware that they do have it, because they just feel like they've lived it for so long, they're not fully aware that that's exactly what it is, because it's a pattern, becomes a routine, kind of complacent with their lives and themselves, that they just think it's the norm.
It's underestimated how it can affect people daily. I feel like it's something that needs to be taken more seriously. There's definitely a stigma behind mental illness where a lot of people that are suffering aren't getting the help that they need.
I think that it's something that is stigmatized, and it needs to be talked about more before we lose just about everyone that we care about. I think a lot of people struggle with it and they don't feel comfortable talking about it. It's something that almost, I feel like a lot of people think that they have to hide it and put on a fake smile for family members or friends or co-workers.
I think mental illness is real. I think that it can be cured, and I also think that we can cure ourselves if we actually tried.
I feel like mental illness should be talked about a lot more. We should be more educated. That way we can try our best to help the people around us.
That was a really powerful story. And then the second question that I asked them was, how has mental illness affected you personally?
It affected me very badly. I almost wanted to commit one time because of my ex-girlfriend. I let my thoughts get the best of me and I let it control me. If I took myself from my family and my friends, and if I did that to them, that would crush me. And I think that there are people out there who love you no matter what. And you might not think people do, but they do. And God does love you. And, you know, he doesn't want you to take your life. He wants you to love your life, and he wants you to live it as best as you can for him. Overthinking can destroy you. Overthinking can hurt you, and drugs and alcohol aren't the way. Your friends and your family, your mother, your father, your friends, your sisters, your brothers, they do love you. You know, no matter what you say, they do.
How mental illness has affected me with depression. You know, I had mentioned, you know, my first suicide attempt was 10. I struggled with a lot of stuff growing up, a lot of different things. And between the ages of 10 and 14, I had tried multiple times. I just was not, everybody seen me happy, ever seen me as this bubbly person, but people did not understand what I was going through. People didn't understand the different things that was going on in my life, or how they're, you know, all the different stuff that went on. You know, people just afraid to actually crap talk in person and using street chat when that was going on, or just people just making stupid rumors and all kinds of stuff that never happened, and I had to take fault and blame and got in trouble for stuff that I never done. And so there's a lot to go with mental illness, but it's also one of those things like my worst parts of depressions have been self-induced, just because of just falling down, just bottling myself out in alcohol in my past. But what we don't realize is just how we can say or talk or what we do, how that can take somebody's hard moments that they're dealing with personally and just throw endless gasoline on it. It affects people in so many different ways that you may make a joke, and that joke just may make somebody feel like it's to them. But it really affects people so differently. You can't fit in a box. You can't take someone's depression and it be just like someone else's. What helps them doesn't help them. I have struggled with depression, and I still do. I still have moments to where I just collapse, and I can't do nothing. I can't physically keep going, and it's just the repercussion scars.
It's affected me from family and friends and activities that I could have participated in, but I was either just cooped up inside my room or just not participating whatsoever.
I myself have had depression and anxiety since I was like 14. It's definitely hard. People will tell you that you don't have that problem, or that you need to suck it up. That's just probably not the best way to handle it.
Mental illness has affected me quite a bit throughout the years. Recently it's gotten really bad, but luckily I have not really overcome it, but I've gotten better about it because I sought the right help and the right people. It takes you into a really dark place, and it's really scary, and I'm so glad I have the great support system that I do.
Growing up, my mom was a depressed kind of person and had a lot of anxiety. She went through a lot when she was younger, baby of 15, and was married by the time she was 16. Her family wasn't very good to her, and her first husband died from, they said, suicide. But she said no. But I didn't learn about this till I was older. I had no idea that there was another man in her life. But then she met my dad and married him. But she battled, I would say, you know, depression her whole life. And as I became an adult, and once she was, you know, put on medicine, she became a different woman. Like, she was much happier, just like a much more content person. So, you know, starting out with that, and then as a teenager, I think I kind of went through a few things and went through a not so great relationship that, you know, someone was not very kind to me, and I didn't really realize what was going on till a little later, but thankfully got out of that relationship. But I think that was hard on my mentality, my confidence and things like that. But, you know, as I got older, and I met my husband when I was 16, and we've been together since then, you know, we've been through a lot as a couple and as a family, but, you know, I think the first time I really realized anything was after I'd had my second child, and I had postpartum depression. and I didn't know what it was. I called the doctor and I was like, something is wrong. This isn't right. And as I told them how I was feeling, they were like, oh honey, just come in and we can help you. So, I was put on some medication, and I'll never forget, my dad looked at me and said, you're too smart for this. You're too smart to have to take medicine. And I was like, I'm a very smart and educated woman, and I'm smart enough to know that if it makes me feel better, it makes me a better mom, that it's okay. And going through that, postpartum depression was hard, but eventually, I did come off the medication and have done great until a year ago in December, my nephew passed away. And I've always had a little bit of anxiety, and as social as I am, and everybody's like, oh, she smiles all the time, is always happy. It's not always genuine, but I'm good at putting it out there just because I feel like I've always been not trained, but taught to be a happy person and to let people think you're happy. Well, after he passed away, and it was, just a sudden, tragic death, my anxiety shot through the roof. Like, my chest hurt. I cried a lot. It hurt to breathe. It hurt to almost live. It was bad. So thankfully, I'm really good friends with my doctor, and I told her, I said, I can't do this anymore. And so she gave me medication, and it helped. But then COVID hit, and it was like back to, oh my gosh, something's wrong. I can't do this. We're having to stay at home. And so we added another medication to it, and I'm still functioning great now on that. It does help. It doesn't take away the pain. It doesn't take away your memories of your loved one. It doesn't take away anything other than the fact that now I can breathe. Now my chest doesn't hurt as often. It still does once in a while, but not like it did. So, mental illness, as far as in like anxiety and depression, I think a little bit of everybody goes through it and just don't realize it until it can get really bad. And I know that, my sister and I both have had a really hard time with it.
Well, as we talked before, I was abused by my mom growing up. It wasn't sexual, it was physical. But for me personally, I never got the acceptance that a little boy's supposed to get from their mother. Like, that you're good enough, or that you're, basically that you're just good enough. So without ever getting that, and then she passed in 2012, and there was no closure, there was no reconciling, the person that inflicted the pain is now gone, and I'm just left with the pain. So the scars you get from your childhood, they stay with you for the rest of your life. So when I deal with kids and I'm teaching kids, I guess my biggest prayer for the kids that I come across is I hope that they have a decent home life and they're not getting these scars. And sadly, I come across several that I think that are, and they quickly become my favorite. And I just want them to know that somebody in their life does care, and is proud of them and does want them around.
Well, personally, it's caused me to have drug addictions and substance abuse issues in the past. It's caused me to hurt a lot of people close to me, and it's something I look back on and regret. But since I've been getting help and realizing my own behaviors, then it's greatly benefited me and helped me realize to cope with a lot of things that I didn't know how to in the past.
I myself have mental illnesses, really bad paranoia, I have PTSD, anxiety, depression issues, and I actually have a lot of friends and family with it. I've had friends that have committed suicide because of it. Nobody noticed, nobody paid attention, because mental illness isn't simple. It presents itself in a million different ways, and unless you pay attention to the person, you're never going to know when it's hitting them.
So personally, with COVID, I've just really, like I said, struggled with being inside, and especially during the colder months. Being outside and getting that vitamin D is really, really important. So personally, it's it's really been hard. And one way I've actually helped is been able to, you know, FaceTime my friends and just be able to talk to them about it. And journaling is also another great way that I've been able to deal with it. And you know, just reaching out to your friends and family is very, very important.
So mental illness has personally affected me in a numerous amount of ways. I struggle with depression, anxiety. I have trouble sleeping at night. So I feel like talking about it, knowing that it's something that we as human beings go through and have to deal with is okay. I am on medication for it. I'm also in personal counseling. It's recently developed into grief counseling, but I was in personal counseling, and you know, that's just developed over time, and now it's all kind of, it's grief, personal, all that you can pretty much think of. So just not being afraid or ashamed to talk about it. That's the main goal that I want everyone to know, is that it's okay to talk about it. It's okay to not be okay sometimes.
Well, I mean, personally, with dealing with depression and anxiety, PTSD, and having recently been diagnosed with borderline personality disorder, it impacts my everyday life and my relationships with friends and family, and even my work area. Having to work from home is very hard for me, so I choose to go to site instead, because with coronavirus and everything, being isolated has definitely made my mental health deteriorate.
I think mental illness affects everybody to a certain extent. You know, we've all known somebody that deals with depression or drug abuse or phobias, paranoia, you know, what have you, because everybody goes through stresses, you know, and we also have genetic malformities. For me personally, I've dealt with alcoholics, you know, in my family going back generations. I've had my own issues with mental illness, you know, and it's very hard to deal with sometimes because there's no way of accurately expressing what it is that you're feeling to people that do not have the same problem that you do.
It has affected me in a lot of ways. I was mentally abused for 15 years, was not aware that that's what it was until I was out of it. There were signs all along, again, until I realized, until I removed myself from that situation, that that's what it was.
It affects me daily, like between work and school. Just having anxiety in general makes it hard to complete everyday tasks. It can be something as simple as just getting out of bed and making your bed and brushing your teeth. Can affect the littlest things. How hasn't it affected me? That's the question I should ask myself. I have type 2 bipolar disorder, and it definitely affects my relationships with people. And you know, it's tough because a lot of people don't know that I have bipolar disorder, and they take a lot of things personally. It's affected me a lot.
It's taken away some of my favorite people. It's impacted my life as far as the friends that I have, the relationships that I have with my family, even, you know, in motherhood. It affects everything. It sucks trying to stay strong all the time. You know, you don't want your kid growing up thinking that it's okay to leave or that it's okay to harm themselves or anything like that. And when it's something that you've struggled with, it's very hard. It's heartbreaking. It's sad. It affects everything. My job, what I do on my days off, how I grieve for my husband. It affects everything.
Mental illness has affected me by seeing other people suffer from it. I just know people that it has affected. And mental illness can change some people's thoughts with our minds, and things that we see and hear can affect us, and we should not let that do that to us.
I know quite a few people that have mental illnesses, and that's why I said in the first question that I feel like we should be more educated, because for them it's important to have people around them that are uplifting and supporting them. And I feel like the more educated we are, the more we can help. mental illness has impacted me because I know people who have mental illness. There was a time when I was very sad and not full of hope. I feel like there have been times where I have had anxiety and been depressed, and it was hard, but I feel like surrounding yourself with people that are uplifting is extremely important, and I kind of pulled myself out of that with the help of my friends.
We're all human, but we all go through things differently. The outcome of mental illness is very powerful, and everybody goes through it so differently, and we have to love everybody the most that we can to try to help each other, especially during these dark times. And I respect everybody that shared their moments on what they went through. The third question that I ask them is, what did you do to overcome it personally with mental illness?
It personally took me a long time. Took me about a year. I focused more on myself, I focused on kind of everyday life. When I went to work, I would be occupied with my head. When I worked and when I was hanging out with friends, I was always having a good time. I did used to smoke weed and I did used to drink, and I used it to cope with my emotions. And the more that I realized that I didn't need it, it helped me more along the way to think that I didn't need it. So throughout my everyday life, I just stopped more and more each day, and I understand that my friends got me my whole life. I thought I was alone because, I thought my parents were always, mad at me or didn't care about me and, all this stuff, which I knew they did, but, I was a dumb teenager. I just realized now that if you have somebody, like I said before, if you have somebody to talk to or somebody to cope to or like a counselor or anything like that, let your feelings out. And I know it's hard because most of us are stubborn and that's our way of life, but I realized that in the end, no matter what, you're always going to have the good Lord by your side.
How I overcome it was, just adventures. I would disappear for weeks on a camping trip or, disappear for a few days, just traveling, and this was even when I was 18. How I deal with it now is basically just more of, workout, paint. I have a huge friggin' plant collection, but really, and honest with you, this answer, it's not how you can individually come over it, because depression is not something that you can fight alone. Trust me, I've been fighting it for years alone, and it's still destructive for me. There's no amount of accomplishments that can take it away. There's no amount of trips that can take it away. And I went all the way across the country last year, New Orleans, New Year's, and just Florida. There's nothing that can physically take it away other than just talking to yourself and not being guilty for what you've thought, not feeling guilty for what you've said to people when you're hurt. Just if you feel guilty, tell them you're sorry. They'll understand that you weren't in the right place mentally and that you were just lashing out. You may have broken a really nice friendship, but that goes into what we can do to help it. When you know that somebody's struggling with whatever it may be, depression, anxiety, just try and be a little more understanding. Now, yes, you may have that yourself, but like I mentioned before, depression, anxiety is not a one-size-fits-all. Somebody else's anxiety may be that they just isolate themselves. Why someone else's anxiety may be that they lash out, or the same for depression. Some people may be more verbal about their bad thoughts with depression, as is to others. The warning sign is when they stop talking to people. And so what we can do to help it is just really like this documentary, to let people speak to what they've actually experienced, speak to how they would love to help each other.
See, I started off in the wrong crowd. I was hanging out with drug dealers, some gang members, and smoking and drinking just to pass the time. Seems like that was the only way to really get rid of it.
I have seen a therapist, meditation, crystals, all kinds of stuff like that. It's a great way to do that. But I myself have seen a therapist. I use people who are close to me, because you should keep people who are, the people who are close to you, you should make sure that they are able to help you and understand you. And if they can't, then you probably shouldn't keep them so close to you.
I wouldn't say that I overcame it. I'm still struggling, but I've learned to cope better with my anxiety and depression. And I honestly didn't know that I had really bad depression until I went to a therapist. I decided to go to a therapist because that is like a number one thing that you probably need. Like, everybody needs to talk to somebody, you know, a professional, if you get the right person, of course. And also medication can help you. Also, again, support systems. And sometimes you might have to change your friends. I've left a few friends that were very close to me that were kind of toxic. So I'm now a little bit better and happier, and I'm really proud of myself, because just a few weeks ago I have been feeling like myself again.
There's a lot of things I think in my life that I've done to help with depression or anxiety. I feel like I've had more anxiety than anything. And, you know, I had started going to yoga. I think that helped. I think spending more time in prayer has really helped. Asking for help from others or prayer from others is a big thing, because I feel like happy-go-lucky people like me are less apt to ask for help, because you don't want to disappoint people because they think you're that happy person. But learning that it's okay to say, you know, listen, I need you to pray for me. I'm having a hard time today. Or, you know, I'm just, my coworker, Miss Weatherly, that works with me after our Ethan passed away. If it wasn't for her, I would have made it. Because I could look at her and she'd be like, you just go take a minute, go take a break. She could tell by the look on my face that I wasn't having it that day. But I think that, you know, along with I did have to take medication, I do think that helped. But, you know, learning to breathe, learning to relax, learning to write out my feelings. A journal, I would think, is one of the best things that anybody could do, is to write things out. People think, oh, you're keeping a diary. No, it's more of a journal to, this is what's happened today, this is what's bothering me today. Sometimes just putting it on paper makes you feel better. It makes it, you know, gets it off your chest and helps you just get it out. It's kind of like one and done. You write it down and you're good. Let's go again for another day. So I think that, you know, journaling, yoga, breathing, praying, and sharing what's going on in your life helps more than anything.
Well, the first step is you have to admit that you have it, and then you have to seek help. And when it became too much, that I thought I have to see a doctor. Okay, something's not right. And it, for me, it was anxiety attacks. Hardest time in my life for sure. And something that was told to me by a person over the phone, the best way to defeat mental illness was a psychiatrist, because they can prescribe medicine, because you can have imbalances in your brain and things that they can help you with. Every 7 years, the human body goes through a complete chemical change. So a person that you know is fine could be, you know, within a year or two in desperate need of mental health. Okay, and it's unfortunate, but if it can happen to anybody. The thing that caused me to overcome it wasn't, and I love my wife, but it was my little girl, who is my whole world. Okay, and I had to be a dad, because not having a mom in the traditional sense, having an abusive mom, it was important to me to be in my daughter's life, to be the best dad that I knew how to be. So I had to defeat this mental illness to be her dad, and nothing was going to stop me.
Well, first, I didn't really think that there was anything wrong with me. I was in a headspace where I had a God complex, where I thought that nothing I did was negative and it didn't impact people negatively in my life. But after hearing it from different people and realizing that I need to get my shit together, shortly after that I seeked help to get counseling and to cope better with what I do and how I perceive things. Mainly, you can handle how you control things, but you can't help what other people do.
You don't really overcome it. It's always there. A lot of people use medications. I really don't. I don't feel like it's always the best way to handle it. I keep a solid support network of friends and family that I can go to. I do a lot of arts and crafts. And when it's really, really bad, I make sure I'm around people that can keep an eye on me, that understand. Music helps a lot. Just try to remember that the way you're feeling is for that period of time, and you can get through it, because if you've gotten through it once, you can do it again.
FaceTiming my friends, just keeping that social interaction, I feel like was very, very helpful. So I did that, and just even phone calls, text messages, asking everybody how each other's doing. I feel like that's so important, just to keep tabs on each other, and that's going to help mental illness in such a big way. And then also, just like I was talking about too, journaling is a great way just to get your thoughts out on paper and just be able to see what you're feeling. And I found that super, super helpful. So for anyone who's struggling with mental illness, I definitely recommend journaling. That is a huge, huge way to just get your thoughts out and kind of give you a better perspective of what you're feeling.
So that's a good question, and I don't really think that anyone's able to overcome it. I think it's just something that you begin to cope with more and more on a daily. You start taking the appropriate medication, you start talking about it, and it just becomes easier to deal with. I don't think that anyone truly overcomes mental illness, but I think that it's easier to cope with once you're on the proper medication and taking the right steps and trying to get back to where you were before all of that.
Well, as far as overcoming it, it's something that you have to work at every single day. It's not an overnight process. Something you have to take the proper steps. And therapy, that's what I did. I did therapy, and I'm on medication. I even, I had to go to the mental hospital and everything, and I had to get proper and immediate help, because I quickly found myself going down a hole that many people have found themselves go down, and I had the self-awareness to try to dig myself out of it. But like I said, it's an everyday process, and you have to find your coping mechanisms that work for you. My coping mechanisms, I like to get tattoos and everything, and I got this one from Malachi, and I have the 19 on my face, and a way of facing my fears. So it's a metaphor, but the number 19 has held a lot of significance in my life, including that being the age that Malachi took his own life.
It was a combination of aging, learning, growing, and also having some medication provided to me whenever I was younger. I definitely think that medication is not the solution for every single person, because everybody's physiology is different and they all have different reactions. But we don't want to stigmatize people that look for help in whatever way they can find it. As long as they understand what they're doing, they understand the risks and the pros and the cons, I think that people should be able to seek it out wherever they can find it. And for me, it was a combination of just family and medicine, and having people to support you as much as they can.
It has affected me in a lot of ways. I was mentally abused for 15 years, was not aware that that's what it was until I was out of it. There were signs all along, again, until I realized, until I removed myself from that situation, that that's what it was.
Well, it definitely helps keeping your mind busy, but not avoiding the fact that you do have something that can affect your mental stability. But definitely keeping yourself busy and just hanging out with your friends and people that you love, and trying to help them better understand it as well can help you overcome it. I started going to therapy in 2018. I didn't become consistent with it until 2020. And me being consistent with my therapy sessions, that's what actually led to my diagnosis. And it definitely has helped a lot, because not only am I helping myself, I'm saving my relationships with the people around me. You know, having bipolar disorder, it could ruin some relationships. I'd never noticed when I was going through hypomania and being irritable for no reason and, you know, being apathetic and pushing people away. Me going to therapy and speaking with a psychiatrist and, you know, getting on meds is getting me on the right track.
I reach out to people when I feel like I can. I tried medication. Medication was not something that worked for me. I feel like it made the process worse. I think it's very dangerous to try and get help as far as medication is concerned, just because it is a trial and error situation. I spend a lot of time in the cemetery talking to Emily and Jake, and that makes me feel better. You know, I feel like they are genuinely looking out for me, and I feel like that's a safe place to talk about what I need to talk about, what I've been struggling with. And I try and talk to my mom and my brother, my cousins, and we all just try and lean on each other for support. I try and take care of my mental health as far as not being negative with myself. I try and be positive and tell myself positive things, remind myself, you know, that it's just one little step at a time, because at the end of the day, that's all it is. You've got to take it one tiny step at a time. If that means getting up in the morning and brushing your teeth and that's all you did today, that was one good step. You've got to take one small step every day for your future self. If that means getting up and going to work, being at work on time, hey, you know, if that's what you can do at the time, that's what you can do, and I don't think that anyone should fault you for it. I know the world doesn't work that way, and a lot of times your places of employment, it's like you can just take mental health days, but I think that it's important for you to always do what's best for yourself, because at the end of the day, no one else can do that for you. So you just got to take one small step, and those small steps add up. You know, everything, it does get better. The times that I've tried to take my life or thought about taking my life, if that would have happened, I never would have met my husband. I wouldn't have my son. And I'm glad that I got to be around for those things.
And I've done some things that probably could drive me crazy. Think something and say, whoa, why is my mind thinking like that? You know, but we have to just keep going and stay strong and know who we are. Maybe everybody's went through a mental illness, but we never should give up and we never should want to harm ourselves.
So I feel like who you surround yourself with is very important. There's going to be negative people that you have to see every day, and there's going to be negative people that you should still be nice to, because you should never not be nice to somebody. Usually when somebody's being mean, they might be going through something themselves. So I think it's important to be respectful to everybody, but I think it's also important to make time for the people that uplift you, that encourage you and support you. And I wrote songs, I prayed a lot, I did a lot of other things that I thought were very important to me, you know, to help me get out of all of that. And I feel like I'm so much more happy, and I just wish that for everybody else, because I feel like everybody deserves a chance to be happy.
Everybody goes through it differently. They take a long time. So for some others, they may never get over it, but it just depends who you are and if you're willing to help yourself. Personally, I may never get over my situation just because she's always going to be in my heart. I got her tattooed, and videos like this, what I'm doing, is giving me inspiration to pursue it, to carry on their legacy. The fourth question that I asked, and this one's really important to me: what can we do as a society to help mental illness?
The improvements I think we should do is we should all work together. And I know all of us have differences towards each other. I feel like, most of us are opinionated people, and, we don't believe such things as what others believe. I think in this time and generation, I think we should work together. And the improvements are cope with yourself, cope with who you are, cope with reality. I know most of you guys have friends that you always start drama with and all this and that, and they upset you, and life is drama. You're gonna get that. But the more you surround yourself with realness, the more reality comes into play. And if you want reality, look for yourself. Don't look for others. And always be there for others, but look for who you are so you can help others in this process of the mental illness. Help others understand that you are never alone. There are so many people out there that are just like you. There are so many people out there that are just like me. There are so many other people out there that think just like you. But just realize everything's gonna be okay. Everything's gonna be all right. I can assure you that'll be okay. So if you believe in prayer, pray about it.
But let's be honest, guys, like, we all have those dark things that we've hidden in the closet. We've all had those attempts, those thoughts. And from my personal opinion, don't hold them in. You need to tell people how you're feeling. You need to tell people those thoughts, because if you don't say it and you just let it eat at you, those thoughts get worse. All the actions and stuff get worse. But when you tell somebody, those demons don't like you telling others about it, because when you tell it, you have somebody accountable. When you tell it, you have them talking to you in a heartfelt way. And don't be ashamed of it. I mean, realistically, we all feel like that in some sense of way. Some of us have those dark feelings. But we also need to watch for signs. We need to watch for people just needing help. We need to watch for, oh, I got upset at this person and they were having a hard time and I was too, and I kind of went it too far. But like I mentioned, no mental illness is a one-size-fit-all, fit in a box. It varies. It changes. It can be one thing one moment and another thing another moment. We've lost too many friends. We've lost too many people. And there's no one to blame in those situations. There's no, oh, I could have done this, I could have done that. Because at the end of the day, it happens because somebody has just lost themselves so deeply. But what we can do is to try and make the days better for each other. We can try and work and talk and, build the community of people that we know that are struggling, and have that accountability for people to have people to go to. And that's really what it's about, is having somebody that you can run to in your darkest time.
Just kind of watch out for the signs, because you never really know. Some people are just good at hiding it, but you still need to check on the people that seem okay, but you just never really know what's going on inside their brains.
Check on your friends. Actually make sure that they're okay, instead of just messaging them and saying, hey, how are you? Because some people will just be like, yeah, I'm fine, I'm doing good. They won't actually go into detail on how they're feeling or how they're doing. Pry it out of them, because some people just won't even make it aware that maybe you're actually trying to go in deep and make sure that they are okay.
It's still somewhat taboo to talk about your mental health, and especially the older generation. They never talked about it back then. They just said that you was crazy and sent you to a mental hospital. I think everyone needs to talk about, no matter if you're a man, men are probably struggling the worst because they're supposed to be strong and they can't cry. Even that's a lie. I tell my boyfriend all the time, you can cry whenever you want to. I will not judge you. And yeah, I've lost a few people to suicide, and it's been a struggle, and I've been there, thought about it. Luckily I didn't go through with it, so that was great. I'm so proud of myself for that. But reach out if you can. Honestly, reach out, seek help, go to a therapist. I have Blue Care insurance, and I go to a therapist, and I don't have to pay a dime, not for my medicines, not for the care. So go and seek help.
Improvements that we can do to help mental illness. As far as in you and I think that this documentary and talking about it will make a difference. Seeing real people, teachers, doctors, students, going through or talking about what they've went through and how they've made it better or how they've made others aware of it. I think that that is the first step in letting others know that it's okay. It's okay to let someone know that you're having, sad feelings or you're having trouble breathing in a situation, like with social anxiety or something like that. I think that in order to make it better, we have to stand up for ourselves and for others and say it's okay. It's okay to talk about it. Make it more normal, because it is more normal. During the pandemic, it's became, I think a bigger issue because people have been more traumatized by staying at home than they have been through a lot of things. But I think stepping up, making people aware of it, letting people know it's okay. I think that's the biggest thing that, I would want to say is it's okay to have those feelings. It's okay to feel that way, but it's not okay not to talk about it. It's not okay to brush it to the side and not address it, because it takes a toll on you as a human. You need to be able to find that happiness that you once had. Find the joy in life that you need. And if there's something holding you back, as far as in whether it's anxiety, depression, a different type of mental illness, address that so that you can be the happiest that you can be.
I'm not a doctor, psychologist, psychiatrist, but without caring, I just don't know that you can. It's like I said before, when the guy's name was Johnny that I met at the gym, and Johnny would come in and you knew that he was something off about him, but he seemed like a nice guy, but he just wasn't all there. And hey Johnny, how's it going? And you say that so many times that the one time that he does actually have a problem and he starts to talk about it, and you want to run from him because, man, this is uncomfortable. I don't know what to say to him. But now you fast forward and enough time has went by that I've wrestled my own demons, and I've been to that hell that is mental illness. And the next time I say, hey Johnny, how's it going? And he starts to really tell me, instead of running from him, I want to run to him. And I want to say, Johnny, I've been there, I understand, whatever I can do to help. And that's when mental illness, I think, will turn for people. When enough people don't run from it, they run to you and say, what can I do to help, because I care. And to me, that's what it's going to take.
I think there needs to be more awareness of it, and it's something that affects all of us. Even though we don't think that things are wrong with us sometimes, there needs to be better focus and awareness of oneself. Also, in this country, mental health and help, counseling, therapy is very expensive, and it's not easily accessible or affordable to a lot of people. And just like with healthcare, you've got to take care of your body as well as you do your mind. But there needs to be more awareness, and there needs to be cheaper options and better access to getting help like that.
The people that make the diagnoses, they need to stop treating everyone like a cookie cutter. What works for one person isn't going to work the same for someone else, not all the time. Sometimes it's medications, sometimes it's therapy, sometimes it's giving the angry kid a punching bag. That's a big thing we need to do, and we also need to start paying attention and being there for people. We need to stop brushing it off and saying, oh, it's cool, let's go pop pills and drink to fix it. No. Care about the people, be there for them, actually pay attention to what they're telling you that they need. Because when you don't, you could lose somebody important to you and you'll never get them back.
So for one, what we're doing right here, just making these videos, getting everyone's opinions about this, because even with COVID-19 and all the lives that have been lost due to this and due to all these other things that happen in our lives, just making it known. Because with COVID-19, I feel like people are just trying to hide the way they feel, or just trying to, just be by themselves. And this is the time where we need to stick together, and we need to come together during this time and make this known, because, if we don't, then no one's going to know you're hurting. So you need to reach out. If you're hurting, just, call someone. There's so many people that love and care for you. So we all love each other, and we just have to stick together during these times.
I think if you are struggling with mental illness, embracing it, knowing that, like I said earlier, it's okay to not be okay sometimes. Knowing that you're human and it's okay to feel that way, and don't be ashamed of it. If you're on the other end and you're trying to support somebody with mental illness, be an advocate for them. Stand up and support them. Be there in any way that you possibly can. Advocate for them to get into therapy. Advocate for them to take medication. Advocate and just wrap your arms around that person, because this world needs so much more love than I think what we're giving out. And if we can just love one another always, I think that, that'll help so much with mental illness and not being afraid or ashamed to speak out and talk about it.
Well, as a society, I think we all just need to bring awareness to it and treat it as serious as it is, and check up on our friends, and know the warning signs and symptoms of mental illness before it's too late. That way we have time to help everybody. And, I feel like this documentary is going to be a wonderful way of bringing awareness to it and show people that, even people that you think aren't struggling are dealing with some of the worst demons you could possibly think of.
I think we need a societal reworking, a reframing of the conversation around mental illness. I think we need to try to prioritize it more at an early age. I think we need to try to focus as much of our resources as possible to identify all the various problems that people have as early as we can, so that we can deal with it from an early age, and that we can provide understanding and confidence and information to as many people as possible, so that we don't have to deal with the people that are lost in mental illness.
To help improve mental illness, I think as a society, we need to be aware that we have a voice and we need to use it, so people know that they're battling this, they're not alone. Because a lot of people are ashamed or embarrassed to admit that they have it and admit to their struggles and what they've been through whenever it's we're all damaged in some form or fashion. So if you feel like it's a bad thing, God doesn't let a bad thing go to waste. Like, we're used with that. There's a reason we're in this position to move forward and to go on with it. Because if we don't, nothing's going to change. So if we remain silent, nothing's going to be heard. So we have a voice. Use it.
People just need a better understanding of it in general. Maybe do their research more. But helping people with their anxiety, like I said, just make sure that you hang out with them, make sure that you talk to them, ask them if they need anything, and overall try to understand them better and ask them how you can understand it better and how you can fix, help them get through it mentally every day. Definitely educate yourself on it. Educate yourself on depression, anxiety, schizophrenia, bipolar disorder, borderline personality disorder. That'll help people get a better understanding of how you could help, because every individual is different. You can't help everybody using the same technique, if that makes sense. I would say listen to people when they want to talk, but when people are battling their demons, they don't always want to talk. Educate yourself on the resources around you. When the time comes, you'll know how to help them.
Be aware of how you are with other people. You genuinely don't know what other people are going through. And not everyone has a good support system. So if you know someone that struggles, it's very important that you try and be there. And if it's a situation where you don't have the mental capacity to handle what's going on in their situation, just be mindful of your own mental health. Be honest with that person and let them know, and help each other. Try and get help together, if that be going to another friend or a family member, a counselor, just someone that you trust that is going to be open-minded, and they're going to genuinely help you. Do not seek help from people that just want to tear you down, because that's going to make the situation a lot worse.
It's the basics. Take care of yourself. Eat healthy. Exercise. Drink water. Associate with people that are your true friends and not people that are just going to get you high and drunk and want to party with you all the time, but actual real people that actually will hang out with you just for you being you. And I swear that's one of the most important things ever, because behind me is a city that I moved to when I was 17 years old, and I met a lot of people that I just partied with. I know a lot of those people are good people, but I'm sure that there were some that was bad. And those people, I forgive them. It wasn't their choice for me to party with them. It was mine. And I was able to stay forward and keep searching for what I wanted out of life and stick to my goals and reach them. So I'm still doing that today, and I'm never going to stop.
This is a great example of what you can do, spreading awareness and educating people. I feel like it's something that's just not talked about as much as it should be. So I feel like that is very important. Like I said earlier, being respectful to everybody, because when somebody's not nice, they're going through their own things probably as well. And I think those are the main things.
Sharing the best memories of the loved ones that are no longer here on this earth. Samantha, you're my blood, my sister, my best friend. I can name a million things that we've done together. You always stood up for me, and you always played video games with me. Did so many things together, go on vacations, on a cruise to go to Mexico. We went to New York, the Virginia Beach. You stayed over. We had so many get-togethers. You had so many good friends that were so kind to you and to me. And because of them, they're helping me get through these dark times. You were a wonderful person, a loving, kind, human soul. I love you, and I will always miss you. You're the reason why I'm doing this. Trying to shed a tear, but I just want you to know, Samantha, you will always be in my heart. Thank you for everything that you've done for me, Sammy. Rest in peace, and God bless your soul.
Sammy. So, when you took me home to meet you and your family, you know, that meant a lot to me. Your family is really great, and they were always so sweet. But I guess when me and you were getting in the hot tub, and you know, we were all hanging out and just having a good time, and any memory with her at all, man, it was just always happiness. There was no sadness. There was always, I mean, no matter what. I mean, with Emily, my sister, or with Logan, or with Grant, or with, you know, all her friends, Kaylee, you know, everybody, you know, it was always just a good time, man. I mean, we never had a bland moment at all. It was always great. Grant, we went to Knoxville, and you know, we had a good time because we went with Tiana, and he just told me all these stories, like all his boxing stories or all these things, and he always cracked me up, always made me laugh, no matter what he did. But he's a very honest man. He was always good to everybody. He was always a hard worker. He had this good personality in him, you know, a good personality that I didn't see in a lot of people, you know, and I feel like that he understood life a lot more than a lot of people did, you know, and he never gave up, as well as Sammy, you know, and they just never gave up, and they always wanted to make other people happy, you know. I enjoyed that every time. So.
See, the first person I considered like a true loss was my great-grandmother. And every time, from the time I was born all the way to 16, I'll go over there and she would always have a nice breakfast cooked for us, or pinto beans on the stove. And there was so much to do over there. Like, you couldn't get bored. and my Uncle Grant. There was one time we drove down to the Shamrock, and we talked about just life and what was going on, etc. Those are definitely times I'll forever miss. And my Uncle Roy, who just recently passed, I'll never forget his ways of teaching me boxing and his way of teaching technique. I'll also never forget our conversations that we had.
Malachi, we grew up and went to school together. He was always a really good friend. We lived a road over from each other for a long time, actually. And we would hang out for quite some time. Me, you, and Sammy and Grant all hung out one day. We all smoked and had a great time. And I genuinely do miss the both of them. I miss you too, Malachi. And Jacob, of course. Even though Jacob, we didn't hang out too much. But all of you are great people.
I have two. The very first one is a family friend that he was basically my second dad whenever I was younger. And whenever I was 12, he committed suicide because of depression. And like I said, I was very close with him. He was basically my second dad. And so upsetting that day. And also the second one was Sammy, of course. Even though I didn't really hang out with her or talk to her that much, I did have a class with her in high school, and she was so lovely to talk to, and I really wished I gotten closer to her.
Best memories. So let's talk about Samantha first. Samantha was in my 5th grade classroom, and if I'm not mistaken, I had her for 6th grade also. I did not have her for my homeroom, but the thing I remember most about her is her quiet, gentle spirit and her big smile. She was always smiling, and if somebody beside of her was in trouble, she was always smiling. Like, she would just sit there and grin like, uh-oh, they're in trouble. She never got in trouble. She was not, she was a great kid, very smart. I never had any trouble out of her, but the thing I remember the most is her smile. As far as Jacob, I remember Jacob being the bright red head that bounced off the walls. He was everywhere. I remember him playing basketball, and he was just everywhere. And he always had a big contagious smile like Samantha. Like, even when he was in trouble, he would smile. And I'm like, are you glad you're in trouble? He's like, nope. I'm like, why are you smiling? He's like, because I can't help it. I'll be like, oh my gosh. It was hard to be upset with him because of his smile and because of him being so funny. But yeah, he was a funny kid. They were both great students to have, and I'm glad that I was a part of their journey.
Of course, Sammy came through, I guess, all of, start kindergarten here, all the way through 8th grade. And there was one time that Sammy and her friend, Jada, they had this, they would stay back. If I hollered, we were outside, and I'd say, come on, line up, we're going in. Everybody would be inside, and a few minutes later, they'd finally come through the door. And like, they'd just come in at their leisure. And that happened so many times, I got so sick of it that finally I thought, I'm going to stop this once and for all. So at the water fountain out there, when they finally came in, I guess I jumped on them pretty hard. And I just let them know that's going to be the last time that's going to happen. And some other teachers that were in a room across the hall heard me and said, whoa, we were even scared sitting over here listening to you. And I was like, I didn't mean to come down that hard. I was just trying to make a point. So you never know how a kid's going to react to that. Then fast forward a few years, Sammy's in high school, and I went to an Elizabethton football game, and she came by. And I was like, Sammy. She runs and gives me this huge hug, right? And so that let me know that that what I'd done was all in the past, and she had the good memories. So yeah. And then when it comes to Jake, seeing him, how fit he got, how when he was in the gym and the workouts that he would do, man, I was so proud of that kid. Like he could have literally been a model, I think. I don't know. I felt like maybe whatever inner demons he had, he turned it into the weightlifting, and he was being successful that way.
Well, with Grant and Sammy, I knew Grant a few years back before he started dating Sammy. And me and him would always, we'd hang out at his house, listen to music. I mean, Grant was a great guy, man. He was just one of the most genuine people that you would ever meet, and he'd always have your back. He was a very loyal person. And, when we would all hang out, you, me, Sammy, Grant, we always had fun, whether we were going out to eat, throwing parties, hanging out at your house. It was always something, man. But those days, I just wish that there was a way that we could turn back time and experience those days again. And, it's just sad, but we can't change the past, but we can always change how we handle the future.
Yes, so Sammy and Grant, they were such wonderful people. And I do remember there was a time where me and Marvin and Sammy and Grant, we were on our way to go eat. And they were both such full of life, like Sammy and Grant both. Like they were just both always smiling and always so happy. And they just loved the life that they were living. And that can make an impact on us as well. You don't know when your last day is going to be. That's just something that we need to keep in mind, just trying to stay positive even amidst hard times that we have.
So this is a hard one for me. Losing someone I grew up with my whole life, it's kind of like all the memories rush back to you, and every memory that you had, even if it wasn't good, is still your favorite now because they're not here anymore. And so I just want to say, don't take those that you love for granted. Enjoy every single moment that you get to spend with someone that you love, because you never ultimately know when it's their last day here on earth.
I have a million with Malachi, but one of my favorites would be one of the times I was picking him up from work. It was like his first day at Pizza Hut. He came running outside and lifted me up and spun me around, and he would always do that because I hated it, but I would do absolutely anything to have him here to pick me up and spin me around like that again. He was so full of life and just one of the most generous people I've ever met. Would absolutely give the shirt off his back for anybody, and his laugh and smile especially could light up any dark room.
I have a lot of memories of my brother. I think about him a lot ever since I lost him, and I'm always reminded of his presence whenever I'm doing something that I feel like is invigorating to my life. Whether it counts as hiking, whether it counts as swimming, anything that I do that brings excitement to me and joy, he's always in the back of my mind, because he showed me a lot of that. It was something I didn't fully appreciate until it was gone. But the memories that I have with him, and also with Marvin and Sammy and Grant, we had a lot of good times. I remember meeting them. I thought they were really cool people, and it's really heartbreaking that it happened the way that it did, because nobody deserves that.
Probably my best memory with Sammy and Grant was when you and Kenny threw that of a Halloween party. That was really fun, hanging out with them, seeing them all dressed up.
Sammy was actually a really, really cool chick. She was just so calm and peaceful. She was a wonderful person to be around, and I cherished it every time I was around her and when I was around Marvin. So God rest her soul. I know Marvin's heard about it. I know his family's heard about it. I was heard about it and shocked. Sammy's in a better place now. She's resting in peace, and she doesn't have to deal with anything from this world anymore. And I believe that our spirits live forever after this. God rest Sammy.
Jake, if he cared about you, there were just times that he could make you feel like you were the whole world. He always took care of the people that he loved, and he could make you smile. It didn't matter what was going on or what he had going on. He can make you smile on even the worst days. Him and Sammy both, they just knew how to make people laugh. They knew how to make people feel better. And I wish that there were more people like that in the world, because they made the world a little bit brighter, and since they've been gone, it just doesn't, it's not the same. You know, the world feels a little less bright, but it's nice to be able to carry them with you and to spread the joy that they had for life and the love that they had for people. It's nice to share that with other people, and you can always be a light to someone else in their dark times and make them laugh and make them smile, because laughter is some of the best medicine. Just make sure that you don't do anything to harm your future self, whether it be with substances or even something as simple as cigarettes, you know, because it always starts small and it gets to something bigger. Like, take care of your overall self. I feel like that's what they're doing up where they're at, and that's what they expect us to do, and nothing short of that. So.
I had 2 friends in high school that committed suicide. They would come over to my house, we'd have pool parties, we'd have so much fun, and it was surprising when they killed themselves, because I wish I would have known the warning signs. And I feel like what we're doing right now with this documentary, I feel like it's so important, because we can help people, we can let them know that they're loved, you know? So I really wish I could have known the warning signs, because I did not see that coming, but they were lovely people. They were awesome, the life of the party. I also have a lot of love for Sammy and Grant, and I remember them, and they were beautiful people.
Oh, there's so many. The best moments. That's tough. The best moments is making that individual proud and knowing you have to do this. Because we're left here for a reason, and they are our strength to keep going forward. Just make them proud. So, too many to mention.